Okay, now we're going to move further into the forum, and we're going to hear from Dr. Sue Matthews, who's the CEO of the Royal Women's Hospital. Sue joined the Women's in 2014. She came from a beautiful part of the world, the Niagara Health System in Ontario, and she's a highly awarded and qualified health professional. At the Women's, she's championed the prevention of violence against women as an area of strategic focus. So please welcome Sue, who will speak on the hospital's role in responding to family violence. Thanks, Sue.
Thank you. I'd like to start by acknowledging the traditional owners, the Wurundjeri people, and acknowledge elders past and present. And is Alex still here? Thank you to Alex. No, okay. I also acknowledge the Minister for Health, Professor Glenn Bowes, who I think has just stepped out. He's the Deputy Dean, Faculty of Medicine, Dentistry and Health Sciences at the University of Melbourne. Professor Jane Gunn, Head of the Department of General Practice, Faculty of Medicine, Dentistry and Health Services at the University of Melbourne. I also acknowledge Peter Faulkner from Bendigo Health and Professor Kelsey Hegarty. Can't wait to see all of the wonderful things that we can do together. So I appreciate that. I'm going with... And there we go. So I guess the first thing is, why are we here today? And I think many of you are probably here because you're responding to the requirement to have family violence in your SOP. Hopefully, that's not the only reason. I think that what we have to think about is that the role of the health system is being recognized as critical in addressing family violence and preventing family violence. So we talk a lot about addressing it and supporting people, but really, ideally, we should be preventing it from happening up front. And on that note, on Friday, I don't know if any of you know, but the World Health Organization adopted a global plan of action to strengthen the role of the health system to address interpersonal violence, and in particular, violence against women, girls, and children. So Australia was one of 44 member states to adopt that resolution, and our new chair of family violence prevention, Kelsey Hegarty, also works closely with the WHO as an expert advisor and will advise on this in the coming months. So this plan of action provides a very strong mandate to address violence against women and girls as a global and urgent public health problem. Today's forum is designed to guide Victoria's hospitals in responding to family violence wherever your hospital might be doing in this work. So I think it would be fabulous if, as a state, our health services could lead the way internationally in this work and responding to the WHO's plan of action. So let's start then by defining family violence. It can involve partners, siblings, parents, children, and people who are related in other ways. It involves violence in many family contexts, including violence by a same-sex partner, violence by young people against parents or siblings, elder abuse, and violence by carers in domestic settings against those for whom they are responsible. So this definition is included in the Strengthening Hospital Response for Family Violence materials, and you will all have some of those, and you will get more of those. It's consistent across the Family Violence Protection Act. I think the thing to remember is that it is gendered, as the Minister said. It is about gender equality and inequality, most frequently and most severely perpetrated by men against women. And the scope of this project has limited our service model to a focus on violence against women and substantially on intimate partner violence. Intimate partner violence is defined as any behavior within an intimate relationship that causes physical, emotional, sexual, economic, and social harm to those in the relationship. So we're going to talk a little bit more about the gendered nature of family violence in the following video. You tell me it will start.
I want to be a scientist. I want to be an artist. When I grow up, I want to be an architect. Police, lawyer, astrophysicist, firefighter. I want to be a nurse. And maybe a pilot or something. When I grow up, I want to be a nun. When I grow up, my husband tells me what to do. When I grow up, my wife puts me first. I won't be seen or heard. When I grow up, I want to tell her who to be friends with. I'll beat my wife when she offends me. When I grow up, I'm going to end up in hospital because my husband hit me.
This is the dream of No Child Ever.
1 in 6 Australian women have experienced physical or sexual violence from a current or former partner. 1 in 5 Australian women has experienced sexual violence.
That means each of us knows one of these women.
I know one of these women. Me.
No child enters this world dreaming of committing violence.
No man wakes up one morning and out of the blue murders his partner.
The long road to family violence starts with the belief that women are possessions, not equals.
Most men are not violent, but the vast majority of acts of domestic and sexual violence are perpetrated by men against women.
Our beliefs about the way boys and girls, women and men are supposed to act are formed in childhood.
Around the world, gender stereotypes and unequal power between men and women are the most important underlying causes of family violence.
We can stop this before it starts.
By saying no to attitudes, stereotypes and behaviours that support gender inequality and violence.
We can help boys create more positive and healthier ways of being men.
We've come a long way since the 70s. Violence against women is on the national political agenda, and there's great work going on in our communities.
But still, one woman is killed nearly every week by a male partner or ex-partner.
The murder of children usually occurs in the context of family violence.
Extreme violence often occurs when the woman tries to leave the relationship.
And those who don't leave live with countless acts of violence every day.
This can't happen. Not on our watch.
Not on our watch.
Not on our watch.
Our Watch will challenge the attitudes, behaviours, social norms and practices that underpin and create violence against women and their children.
We will engage the community, educate, raise public awareness.
And keep violence against women and their children on the national agenda.
Until life is better for all.
You can help us.
It's the responsibility of all of us.
Challenge stereotypes.
Call out sexist attitudes.
Speak out if you hear excuses for violence or victim blaming.
Spread the word that violence is never an option or a solution.
And there is no excuse.
Acknowledge respect and equality when you see it.
Celebrate our role models.
It's up to you.
It's up to me.
It's up to us.
Because we can create this world.
When I grow up, I want to be proud of who I am. I want to be friends with everybody. When I grow up, I want to change the world. When I grow up, I want to be me. I want to be me. I want to be me. I want to be a superhero. When I grow up, I want everyone to be happy. We deserve to be equal. When I grow up, I want to be safe. I want to be safe. When I grow up, I want to be safe.
Together we can work to end violence against women and children.
It is time to stand up, to speak out, to take action on our watch.
It's time to act on our watch.
So why do we need a service model for hospitals in particular? I think most of us, many of us are healthcare professionals or work as a professional. I worked as a professional nurse for a number of years in Canada, and I never knew what to say to people.
This is the story.
I never knew how to ask the questions. I never knew what the signs were. Sometimes you knew that something was happening, but you didn't know what to say. And I think that evidence tells us, though, that women tell a health professional first. But if the health professionals aren't comfortable and confident or have barriers in their way, then we are preventing that from happening. The barriers, high workloads, not knowing what questions to ask, concern placing the women at heightened risk. So if I say something, does that make it worse for her? We don't understand this as healthcare professionals. We feel helpless. We don't know how and where to refer someone. So if someone does tell us what's going on, we don't know what to do with that information. So sometimes we don't ask for it because we don't have anything to do to say to them afterwards. And feeling that they're being pushed into another role. This isn't my role. I came to do this. I didn't come to do that. And I think we have to change that approach. We have to look at a systems model, and the model that we're using that is based on Kaiser Permanente's systems model. It's a systems model approach. It aims to support family violence responses across the whole healthcare system. Bridget McCaw, as the minister said, is going to Skype in from California, and that's where she works at Kaiser Permanente, so she's going to talk a little bit about it. In brief, it just requires a whole of organization commitment and response. You can't do it as an individual. The whole organization needs to be part of it. And it requires us to work in partnership partnership with local agencies and family violence services. It's not only in the hospital. It requires us also to not only support our staff to respond to patients, but to support them, as the minister said, because many of them will be experiencing family violence. And when I was a frontline manager, I had a nurse who was being abused by her husband. And I was months before I asked her the questions. Everybody's talked about it all, the coffee time. Everyone was saying, oh, I'm pretty sure. But no one said anything to her. And this whole approach is to bring us there. We've done some research at the Women's, one of our Casa House counselor advocates, along with Professor Kelsey Hegarty, from Melbourne Uni, have surveyed over 530 staff about the experience of physical, emotional, and sexual violence by their own intimate partners, family members, and others. So we're really looking forward to the publication of those results. No pressure, Kelsey, because it really will help us to understand the implications and the impact of that. In the Royal Commission, Professor Frank Oberklade from the Royal Children's said, I think that all universal providers, nurses, GPs, childcare workers, teachers, need to have some training in recognizing family stress and the signs of stress and violence as well. But we can't expect everybody to become an expert. What we should expect, is each of these providers to recognize that things aren't going particularly well and to refer early and to know who to refer to. But we have to give them the skills to do that.
911, operator 901. Where's the emergency?
127 Brynmere.
Okay, what's going on there?
I'd like to order a pizza for delivery.
Ma'am, you've reached 911. This is an emergency line.
Large with half pepperoni, half mushrooms.
You know you've called 911. This is an emergency line.
Do you know how long it'll be?
Okay, ma'am, is everything okay over there? Do you have an emergency or not?
Yes.
And you're unable to talk because...
Right.
Okay, is there someone in the room with you? Just say yes or no.
Yes.
Okay, it looks like I have an officer about a mile from your location. Are there any weapons in your house?
No.
Can you stay on the phone with me?
No. See you soon. Thank you.
We have to give everyone in the whole system the tools to recognize and acknowledge family violence. And the Women's and Bendigo Health are really proud to offer our service model as a way to help you in this work. The service model will be described by Michelle Schwensen after tea. But in closing, at the Women's, we're proud that we've made the prevention of violence against women a key strategic area of focus for us over the next 5 years as part of our new strategic plan. It is our responsibility as hospitals and leaders in our communities to respond to family violence and to create a culture that doesn't accept any form of violence. I hope that today provides each of you with some ideas and guidance about the steps that you can take at your hospital. We need strong leadership from hospitals to create a culture that does not accept any form of family violence. And the Strengthening Hospital Response for Family Violence service model can guide hospitals in this work. And you are the leaders that will take us there. Thank you.